Back at ASAP's 2018 with Dr. Weinstein. Welcome.
Hey, Drew. How you doing?
Good.
Good to see you again.
It's good to see you again. How's the show going so far?
Well, the meeting has been really good. I've gotten to see a lot of my old colleagues and discuss a lot of very interesting topics and pertinent topics that relate to my patients.
So talk to me a little bit about your practice.
Well, my practice is really focusing on cosmetic plastic surgery. That's why I'm at the aesthetic meeting now.
Yeah.
And one of the big problems that we're seeing is patients come in and they want to have their jowls fixed.
Okay.
And this could be a 40, 50, 60, or even 70-year-old woman or man who doesn't like the way their jowls look. And invariably, they want a non-surgical solution. And everybody wants to have just little fillers and go home right away. You know, certainly that would be great in a perfect world. You know, if I could touch them like E.T. and make them better, that would be even better because it would be done in 1 second. But the reality is that many patients are not really candidates for non-surgical procedures because the jowls are so far gone, the skin is so far gone, and the neck is so far gone that the only way of fixing that is with a proper facelift with SMAS. However, there are patients who, because of circumstance, cannot have that facelift because they can't afford the time. They can't afford the procedure. They can't afford the time away from certain activities that they have, like taking care of a parent or taking care of children or in business. So those patients may opt for a non-surgical procedure, which may temporize what's happening. So if they have a wedding coming up and they've only come to me a month beforehand, we could do something called a thread lift. Now, thread lifts have different names. Right now we're using a Mint product, which is a non-invasive procedure, which just involves some tiny threads that go into the face that lift the jowls or lift the neck. And that'll last a good 6 months to a year, and in some patients as long as 2 years. And apparently Dr. Wu out in Singapore said 85% of patients want additional threads at 2 years.
Okay.
So
tell me a little more about that process. So you're actually inserting threads and tightening them? Talk to me about that.
Exactly. So the threads actually have barbs on them, or they have cones. There's a silhouette lift which has cones and a mid lift which has barbs. The barbs go in both directions. So the key is to get that set in the face, in the deep tissue of the face, to allow you to elevate it in a very quick and easy pattern. Now, one of the problems is you can have little pinched in appearance of it. So you have to have a little bit of skill putting this in and understand the face before you put this in somebody. And also, you don't want to do it on a patient who's very thin, because if they're very thin, you're probably going to see those threads in the face.
Okay.
And then probably not the best candidate for it.
Gotcha, I see. So you when you put these threads in, you have total control over how tight you can make it, right?
Exactly. And
Gotcha.
I'll tell you, I was in a single patient that hasn't been pleased with the results from those threads that I've put in.
Yeah. Awesome.
And they look natural. I mean, there's a way of doing these things to make people look unnatural.
Yeah.
And I think there are people who overdo things. And I think the key is, you know, as in my practice, we do things naturally only to a certain extent. You know, fillers are very good also. You could put something called Voluma or Radius in the cheeks to help fill them in. But you don't want to have big, puffy, doll-like cheeks that look really fake.
Sure.
You know, a little bit can give you a natural appearance. A lot of it can really look strange. So the key here is having somebody who has some type of aesthetic understanding, who's going to do it in an aesthetic manner to make that face look optimal each time.
Awesome.